When I came to Hyderabad after my army tenure way back in 1996 or 97, medicine was different. Then I joined Apollo hospitals. I was there for a decade. I am sharing you my experiences. I met couple of doctors, nursing homes, hospitals to do and to practice my work because sports medicine is not understood. People thought sports medicine means physiotherapy. Some thought maybe I give medicine for sportsmen. Some thought I have a magical remedy spray or something which can make injuries vanish and they run. It is not. That old time sports medicine training which we got, it is a concoction of all specialty subjects. Internal medicine, non-surgical orthopedics, ergonomics is very, very important. We call it there biomechanics. And we do study about intensive care because on field we have to provide first aid, both basic life support and also the further treatment till they reach hospital. We do a lot of non-surgical injury management. Today that's what I am doing. I saved more than 25,000 people from operations of back and neck and saved many people from knee replacements. At least I have postponed their period of surgery. It is possible by a lot of lifestyle modification. So sports medicine is a subject of modern period. It tells you about nutrition. Otherwise, our nutrition was restricted to clinical nutrition, where a trained dietitian, nutritionist advised to the patients. But nobody talks about nutrition for a normal person. That is where we come into picture. And military training and sports medicine training gives you an upper edge over nutrition. Why? Because all these people are fittest population. Sports and military serving people are the fittest people in the world. How it happened? Because their nutrition and their travel nutrition, their stationary nutrition where they are stationed in different countries, all related to their genetic nutrition. That means nativity, your genetics, your geography where you were born, millions of years where you ancestors lived, it is all is the foundation for planning a nutrition. It is not that if you eat badam, cholesterol will go down. If you eat avocado, your vitamins will go up. It is all trash. You don't eat just because something is there in this. You can't eat this bottle because plastic is good for health. No. We have to eat our genetically endowed nutrition over the thousands of years. You have to eat your food which grew in your place. Grand, many generations. And you have to eat your food which suits you also. You may have intolerances. All these are advised by sports medicine doctors. Not all of them, at least I am. A lot of my colleagues, their knowledge is restricted to injury management. But injuries can be managed by physiotherapist, masseur, Ayurveda, massage, homeopathy doctor, naturopathy doctor, orthopedic surgeon. Everybody can manage injury at different stages. So injury management is not a big thing, but injury prevention is big thing. So you require a good training program and training modification to prevent injury. I have 2, 3 named trainees whom I advise regularly. They are doing very well. The only thing I can vouch is they have not got injuries because I could convince these parents to bring down their intensity of the training. You will be aware, lakhs of people are playing badminton, lakhs of people are playing cricket, lakhs of people are playing other games. You know the injury status in Indian sports children extremely high. In fact, there are cricket players of 17, 18 who have come to me already advised for back neck surgery. I have their MRIs. Just watch, think. It is pathetic to do surgery on kids. Even it may be indicated in subject of medicine. Prevention is very, very important. Most of the ligament injuries of the knee joints will improve over the period of time if you condition the muscles around the knee joint, if you maintain the care of the knee joint, if you modify the training of the knee joint. But we don't do it. We have no time. A senior expert in a big hospital has only few minutes to see a serious injury of a player who spent already 10 years on ground. So these are the things a sports medicine doctor can help you. Coming to nutrition supplements, vitamin D, in fact, one of the early prescriptions of vitamin D is written by me only in Hyderabad. I can vouch for it. There was no big testing of vitamin D also available those days. But today, every doctor writes 60,000 units every week for 3 months. After that, my dear experts, you don't know. Body can retain only couple of weeks to months your vitamin D which is gone in a very, very smaller quantities. Once a person is deficient, he's deficient for life. And whenever you prescribe, at least check their vitamin D levels. Nowadays, the cost has come down. You can't just write 60,000 units, take it. Another person says, sir, everybody is vitamin D deficient. That means you also want to be deficient. So this is where sports medicine comes into play. Unfortunately, there are no big degrees, there are no big courses in our country. Even if some private universities have started, there are no teachers. They all learn physiotherapy, basically injury management, and some vague nutrition. Give millets, eat whatever you want, or do fasting so that your health improves. No. Vinashakale viparita buddhi. When you deviate from a normal range of life, it leads to trauma internally, externally, emotionally. So this is a very important subject. Why I'm telling you all this? Because today, a lot of people, if you do surgery on two sportsmen, you become a sports medicine doctor. I see so many places, sports medicine, everybody is sports medicine doctor. They don't know how to modify training. What is the endurance training program, strength training program, speed drills, how to modify training program, how to write a periodization, how to write a pre-game meal, post-game meal, how to do competition nutrition, water management. These are sports medicine. Doing a surgery on persons is not a sports medicine. Sorry. Even if you have a degree of sports medicine, it is the work what you did is important. For example, I'll tell you, I worked with the England cricket team, IPL cricket teams, Indian athletic teams, boxing, rowing, and handball team, kabaddi teams, women cricket team, so many teams. We have to literally travel with them. And of course, tennis, lots of, and perform bigger. Because when a child reaches around 16, 18 years, education, profession, parental pressure, and lower socioeconomic people earning, all these come into picture, and then focus will get diluted. There are only few people, like Saket Mainini, great tennis player. I know him since childhood, who sustained long time. There are a lot of great, talented children in India who require sports, medical support, and governments also, it's on the paper. You require people who have good training, good experience. They should travel with the players, sleep with the players, eat with the players, and understand what is their emotional status, what is their how their body behaves, how their mood changes. Then only you can make a champion. There are also coaches who get the students already who have won or about gold medal or a state level, and they go and train them. Any game or any sports athletics, and you become a great awardee. Who is the great coach should be given a great award? Who have worked from the childhood of the player, since childhood. You can't claim halfway, this is my training. No. Like that, thousands of people have given advice in between. We don't claim that I have created them. No, it's only small advice we have given. So this is about a sports medicine, how it should be in India. Still, it has not taken up a big ride. I want junior doctors, physiotherapists to come to me. I want to train them. Nobody comes nowadays. Everybody wants money. Shortcut. When I was in Apollo, I had 3, 4 junior doctors, physiotherapists who used to really happily come and work and learn. Really, I want to teach a lot of skills to some medical professional who is really serious in learning, or some good physiotherapist who can really, if you only think of money, there are lakhs of people, but your quality in your ability and your professional skill and your dedication to save your patient or a player is all that matters, and that can make you a great expert. You may have certain negative aspects. Everybody has certain negative. I also may have, but those are apart. It should not disturb your focus on your professional work. This is my sports medical experience and understanding. I am at your service. Take care.